Now, it is estimated that at least 184 million rand is needed to repair 84 health facilities that have been affected by floods in KwaZulu-Natal. These include 23 hospitals, 34 clinics and 3 community health centres. For more on this, we're now joined by Deputy Health Minister Dr Sibongiseni Dhlomo, who joins us via our phone lines this morning. Dr. Dhlomo, it's great to have you with us on the programme. I want to begin by asking you this. 184 million rand, given the extent of the damage, on the face of it, do we reckon this is going to be enough money?
Good morning, ma'am, and good morning to your viewers. Yes, this is a preliminary estimation by our engineers in partnership with the engineers of the Department of Health in the province. Of course, they have to be making a final assessment of this estimate so that the minister could be able to table that to the National Treasury. They probably, as you dig in more, you could then find more other things there too. So, but it's roughly 184, as you are rightly putting it. But I'm sure it may as well change when they do a detailed analysis and the assessment of the situation.
Right,
yes.
Right. So I understand that detailed analysis is still outstanding. But at the moment, can you describe to us the extent of the damage there?
Yes, maybe do allow me to make this very important announcement that we are very delighted that our forensic pathology services were up to a bit. They did their best over the Good Friday weekend, and of all the bodies that were there in our mortuary, 377, to date, all of them have done postmortems, and therefore we are calling on the relatives and all the family members to come and really collect and claim the bodies for burials. All of them can, without fail, bury this weekend, and we are delighted about that. Sad as it is, of course, for every cloud there's a silver lining. So that announcement is very important for members to claim, and they must also call if they need assistance, and there's assistance coming in for support. Yeah, so on this issue that you actually raised, the extent of the damage is in various forms. We started at the Prince Mshini Memorial Hospital, where there's not much damage, but there's an indirect suffering because of the water cut, which is affecting the whole of Umlazi Township, and therefore our hospital could survive for 4 days post the floods with the reservoir that are actually up there. But those 2 million liters of our reservoir in the hospital have since dried up, and our staff members, patients are coming in, finding a hospital without water. But as of yesterday, there were tankers, 20 water tankers that were supposed to come in the evening, push the water right into our reservoir so that the water can start now flowing into the whole water system of the hospital, and we hope that will be taken care of today. The north of Durban is where most of the clinics that we are talking about were mostly affected, some of them up to the ground, and some of them have remained closed because we can't actually even enter. We have been advised not to really enter those. The floors are very shaky, and there's still water inside there. So what we have since done as a department, very innovative by the provincial department, is to then have mobile clinics standing around those areas where people will come in and look for a service and not find it. We also have put up mobile services around the community halls where people are kept. When people were washed away with everything else there, even the medication that they were using is gone. So that service also the minister and the MEC were actually putting in place. We did not go to the other districts that are affected, which also is Mkungundlovu, Ilembe and Ugu, but remained extensively around Durban where there's a major damage and also support. And that is what also we could offer for now, to really make sure people are not without medication for those who have washed away. But another caution, ma'am, is that because of the water cuts, people are really scrambling for water, and they go even to the boreholes, to the potholes in the streets and just collect that water. And we want to caution our people, desperate as they may be, some of the water may be contaminated, and we probably would not want to wish now to get into another issue of an infection coming in from the water source. But we are pleading with the municipalities and all those who are supporting us with water to the communities to continue supporting the communities much more, so that people could not then err on the side of getting water from those stagnant waters in the roads and everywhere where they really look for at least a drop of water.
Yeah, it points certainly to the desperation, doesn't it, Deputy Minister, of people looking for water in potholes. There are a number of water tankers that are being deployed at various parts of the province. I want to ask you this. You talked about the mobile clinics that have been taken to major centers like eThekwini. For those regions where you've not yet been able to reach in terms of mobile clinics, you mentioned the Ugu district municipality as well, which you haven't been able to reach yet. What is the course of action for residents there who are in need of medical assistance, and what's the plan?
Yeah, look, there are areas where you have a constant mobile clinic going to, let's say, Akonuk district every day. We would then want to announce that some of those areas that are constantly anyway supported by mobiles may have to actually be diverted to go and visit those people in our community halls. So the same arrangement that is actually applied in eThekwini district, the MEC expects it to be rolled out in those affected areas. So people in the areas where they are, because the clinics are probably not functioning or far away from them because they're in the community halls, we should take the medication closer to where they are and visit them, and making sure that they don't run out of their medication. Yes.
Deputy Minister, it's a long-term plan, isn't it? There's a lot of work that needs to be done in KwaZulu-Natal, not only in healthcare services. The timelines that are in place, can you give residents there any indication of when things will be back up and running, even close to 100%?
Fortunately for health, unfortunately for the Department of Education, we do not have, like if you really mention 23 hospitals, 34 clinics, 3 community health centers, 184 million. In some of the issue areas, it's work that could be done within 2 to 3 months. It's major repair. It's just refer to the roof, stop the roof leaks, to, make sure the ceiling is not falling, and things are. So it's not major. There are mainly 3 areas, big hospitals like Wentworth Hospital, Justice KZN Hospital in Stenga, and that's Newtown CHC in Inanda. But some of them are actually minor repairs, to moderate, just cleaning up and getting the ceiling back into its system, cleaning this and that, and repairing that door, making that. So it's probably some of them would be, I don't know what the engineers are saying, but some of them should be getting back to be in full swing within 2 to 3 months. Yeah,
let's hope so. In the meantime, let me thank you for your time. Dr Sibongiseni Dhlomo is the Deputy Health Minister, giving us an update there on the situation insofar as healthcare facilities in KwaZulu-Natal is concerned. 184 million rand. That's the provisional amount that's being earmarked in terms of repairs to those 84 healthcare facilities that have been affected by the floods.